Bossing Talkback. Our question, should the generic drugs-only provision of the cheaper medicines bill be deleted? Some comments from our viewers. From Jay, the bill shouldn't be scrapped. Drugs with the same generic name are the same bioequivalent. Yes. The difference is really in the packaging and branding. Frankly, there is a bias on the part of the PMA, as some doctors have support from drug makers. From a viewer, takot lang ang mga private doctors na mawala ang mga incentives at benefits nila sa mga pharmaceutical companies. From June Rosqueta of Cagayan de Oro City, cheaper meds bill should be passed into law. Like in the case of my wife, she was prescribed by her doctor a branded medicine, but she was not cured. She took generic meds and her ailment was cured. From a viewer, if they want to delete the provision, okay lang, basta make it is illegal for doctors to receive any benefits, free trips abroad, hotel accommodations, etc. Ang sinasabi mo, against your code of ethics ito, no? They want to make it a stiffer penalty. Can the country be involved here, the nation?
Violation of the code of ethics could result to suspension.
In the PRC, in the professional. From the pharmaceutical companies, the reality is some doctors prescribe medicines that are not really better than its counterparts. Kung ma-approve yan generic drugs only, paano yung mga detail man? Di mawawalan na sila ng trabaho. Mario Alberto of Catanduanes, the issue borders on ethical conduct of some doctors who may not be protecting the patients but their income. From a viewer, our doctors don't want to use generics as they will lose the secret income and perks from the drug firms. Doctors deny this as there is no paper trail. The med reps handle it. From Pamela Hison of Malolos, paano nga may hidden agenda rin ang mga drug companies sa mga doctors na dapat ang gamot nila i-prescribe at may libre sila sa mga companies na yan. I am just so awed at this feedback that I'm getting from the public. Doctors should be given leeway in prescribing medicines within the parameters of the Generics Drugs Act. From DJ, the doctors or drug companies don't want the generic drugs only to be prescribed because that is where the perks come in. From Lucy Magda of Manila, the law will only work if the government can ensure the quality of all meds in the market. Generic meds from India, for example, are so cheap, but I will certainly think thrice before giving it to my daughter, especially if it means a difference between life and death. The problem with some doctors is that they are prescribing a particular brand of medicine because they are getting commissions from the medical representative of the drug company that manufactured the prescribed medicine. Are there still more? I don't think there should be a problem for the cheaper medicines bill. There are good and cheap health centers for people who can't afford expensive services. Wow. Okay. Looking at the Talkback Texas, people still think it's the perks that the doctors get, and this is one reason they think that they do not agree to a generics only.
Hindi natin masisi dahil dito sa atin kaugalian niyang payola. Dito sa atin.
So tinatanggap mo na merong payola na nangyayari, isang uri ng
perception.
Perception. This is not at all true.
Pwedeng meron nangyayari, pero sabi ko nga, para maiwasan natin ang madamay ang buong kadoktoran ng buong Pilipinas, the whole members of the PMA, dapat ito hindi ito tinotolerate, dapat ipinagbabawal to ng even drug companies itself. Ang sabi nga, we are for cheaper drugs. At the end of the day, when you can confine patients in the hospital, minsan wala na yung professional fee namin, nauubos. Ang nababayaran lang ng hospital yung mga nagsabay hospital, puro drugs. Kaya we want cheaper drugs. That's why we support the Senate version of the cheaper medicine bill. Kaya nga itong mga drug companies nagagalit sa amin, mga multinational, dahil we supported the Senate version. Ay ito pa ba ang igaganti sa amin na kami ay binabayaran o binibigyan ng perks? Ang gusto nga namin, kung gusto nilang may mga violation sila, isara sila. Kung sila ay nagsasamantala sa Pilipinas at sila ay puro lang pagpapayaman, masara sila. Ang ating tulungan yung mga local growers para ang yumaman ay mga Pilipino, hindi yung mga multinationals, baka foreign owned pa yan Tayong mga Pilipino, ang hirap natin dito baka dapat ang payamanin natin dito at maging matagumpay yung mga businessman na local.
Congressman Garin, yung pag ipinasa itong cheaper medicines bill na ito into law, mawawala ba yung mga ibang pertinent portions, will it contradict with the generics
The
existing generics
No,
act?
it will not. It will actually strengthen the Generics Act because there are already enclosed penalties and criminal liabilities of doctors doing this. Kasi andyan dyan, it's with BIFA, the record is there. There are a lot of doctors that has been sent memos, pero walang nangyayari kasi walang ipin. There's no teeth to that. Now, I don't know if Dr. Sabili says they are. The Philippine Medical Association is for cheaper medicines. Then if you are for cheaper medicines, please support drug price regulation. What will drug price regulation do?
They support the drug price regulation.
We read the bill and it's
Well, pardon me, but going over the minutes of the hearings conducted in Congress, they were very much supportive of the amendment to the patent code, which was the Senate version. That's why you keep on repeating the Senate version. What is the big difference between amendment to the IP law and drug price regulation? Patented medicines comprises only 5 to 10% of the drugs being utilized by Filipinos. And that is an exact record, and even the top 20 medicines being purchased by Filipinos, as shown by DOH with the corresponding brand, none of them is patented. But what will drug price regulation do? I am very amenable to taking away the generics-only provision as long as the Drug Price Regulatory Board will be in place. Why? Because drug price regulation will put the marketing cost at a maximum of 15%. And the profit of the manufacturer down to the distributor, down to the retailer, will be a maximum of 50%.
It's going to be like the Energy Regulatory Board.
Well, in this
where
case...
you're supposed to fully disclose where every centavo of what your actual retail cost is comprises.
Well, in the case of...
Is that how it's going to be?
In the case of medicines and drugs, you can have a formula which is actually being done by India and being done by Thailand.
So that means the multinationals as well, who are putting their branded medicines here, will be subjected to a drug regulation?
There is a corresponding range. Why is it that a specific brand, entirely the same brand produced by the same company, being sold in Thailand or being sold in Singapore and even Malaysia, is 50% cheaper than the same brand produced by the same company in the Philippines? Why? Because they have drug price regulation in their country. And so yung talo nila doon because of probably marketing, binabawi nila dito sa Pilipinas. And let me also cite the trade aspect.
And you've investigated this, na yung talo nila sa Thailand dito binabawi sa Pilipinas.
Well,
baka naman that's too sweeping.
Well, it's a presumption you get. Kasi why do you sell it there? And then they put in on, we call it the paper cost. And how does this happen? Like the company will say, oh, we manufacture this drug in the US. This is just an example. They manufacture this drug in the US, and then sasabihin nila, dinaan namin sa Singapore, dinaan namin din sa Hong Kong, tapos dumating sa Pilipinas. So you have paper cost. Pero the actual situation is they manufacture it in probably Thailand, then send it direct here. But on paper, they put this and this and this, increasing the cost. If you have drug price regulation, there's a ceiling. And it would be a range, like a range of 100 to 200%.
Okay, Senator Cayetano, the BICAM will begin how soon? As soon as all of the emotions and
subsides.
I think with or without the emotions, it's going to push through as soon as we resume, which is next week.
When are you resuming?
We're resuming on Monday, so I'm sure the chairs will agree on a common date, and then the committee members will be present, and we'll have what we've always said, the chairman and I, is that is our job, to ensure that we are able to come to meeting of the minds on differing provisions.
Wala nang mga resource persons.
They're there.
When the BICAM
They're there in the back.
about.
They're there in the background.
They're not. They still can be called.
Parang ano to parang it's more like defending something on the floor. It's the legislators who are discussing, but the resource people are there, and sometimes they're given the microphone, so they'll be there. In fact, I've asked some of my the doctors
the
UP doctors. Di naman UP lang ha. Meron din naman mga UST at iba pa. But I've asked them to be there because these are very important issues. And what I'd like to stress, though, is regardless of the differing provisions that we have, I think we all agree that this should pass. And the assurance I can give on the part of the Senate is if there are provisions that we do not support, it may be because we need more time, like I had said, and be happy to do this by way of another legislation.
Abangan is my term. Abangan on how the BICAM will tackle the issues and how the Philippine Medical Association will honor their threat of a walkout?
Abangan.
Abangan rin. Anyway, maraming salamat, Yusek Padilla, Congresswoman Garin, Senator Pia. It's always lovely to see you. And Dr. Sabili of the Philippine Medical Association. That's all the time we have. Talk to us again next week on Talk Back.